All right, we're ready to go. So here is set image. Okay, and we'll make it fast. See if somebody's coming in. So again, this is genital wart, cervical cancer, papilloma. This is a classic example of these warts when they protrude have this kind. And I've seen them in a very, unfortunately, including the genitalia, and external, and they can be internal, and they can be obstructive if they're internally located. Just think of what it could obstruct with regard to the female internal genitalia. And then there's lots of ones that are not, they don't have this quote unquote warty appearance in the cervix, etc. And I mean, this is really, and this is the time I think where we give it the most attention. And you'll see some of the numbers. I'll flip over to the other PowerPoint at the end. They have some numbers at the end of this, and the other one, Cowan, has newer numbers because it's more recent publication. It is scary for all of these. It's very scary, and the purpose is not to frighten you, because inevitably the people who are here in a university setting are being educated. You're aware of these things. There's a lot of people who are not. They hear about these things, and behaviors are always very, very difficult to change. Okay, and a lot of people go through those periods of time until they find out it's something. Now they're stuck with it. And again, just like to me, when you're dealing with herpes or you're dealing with HPV, which are things that are thankfully to some extent treatable, versus HIV, which is a lifetime diagnosis. And that's what we talk about today, as well as trichomonas. So it's a lot of topics. I did finish, I'm sure some of you I got the last recording in. Bon chance with that. Good luck. So, but I'm available. We have all next week. You can look at those. There's a fair amount of stuff to cover when we do wound infections, which are starting on the wound part of the program, which starts, let's see when, next week. And I don't know if I can get that in 2 days, but it'll probably leave some time to review on the Friday. Typically, we will not have class on the Monday. It's hard for me to have morning classes on that day because we have Science Day. However, I mean, you can do what you want. We have a lot of, both in the atrium where our offices are located. Science Day means presentations by typically junior and senior students doing reports of research, internship. They're relatively brief, a nice atmosphere, lots of goodies, food, and things like that. I'm making jambalaya for those who are interested in a rum cake. Jambalaya. Oh, we have to work on people have more traditional food. So it happens to be May 4th. Now imagine next year you're invited on May 5th. And that'll be great because it'll be Cinco de Mayo, and I'll have my pork al pastor and a variety of wonderful dishes. But they tell me May 4th is all. Take it to me for a Star Wars fans. May the 4th be with you. So they're doing I think some of my colleagues are more into the dessert stuff than the traditional rum cake, if they only know what they're saying. But you're invited. Don't look at me like that. My eldest said when he started with Duquesne, I said, "Oh, we went here, we went there, all that during that first year. Why did you go to that? You have no interest in that. It goes free food." See, moving on. Back to more unpleasantness. Most HPV infections cleared without signs or symptoms. That is true. The vast majority of these conditions, that's the educational part, are just warts. And they go away. A lot of times you don't have to treat them unless they're unsightly, painful, start to spread. Maybe there's some other skin condition or there's anything that looks suspicious. The trouble is, unlike that picture, I mean, how anybody could ignore that, or I won't even get into what it might have on their partner. I won't discuss that. But warts can appear approximately 3 months after the infection, and that's again the problem. It doesn't mean they're not contagious. Before they appear, the person is contagious, and look where it can occur. Enter shaft of the penis, vaginal opening, anally, persist after wart removal, causes more warts. It's there. It's forever. It's latent. It doesn't always recur, whether the common wart, but the problem is trauma and friction undoubtedly play a role. That's something you have to be very, very wary of, and get it checked. Partially block the urethra or the birth canal. Infants can be infected at birth. Do I go on and understand all of these? All of these are true. There have been recently. There's a tremendous uptick in throat cancer. Most of it has to do with oral sexual intercourse. I'm not making a value judgment on anything. I'm just informing everybody this is particularly true. There's a lot of this is. I'm trying to. If you just look at the increase in oral throat cancers that are secondary to HPV on any article that's written or any news article, it would astound you. Okay, so all of it, I mean, that's the difference between we're studying it more. People did not know or chose not to know or accept that there were potentially problems. I can't express it to you any other way but trying to provide you with information so that you can be aware of things responsibly. So here we are, HPV, naked, double-stranded DNA virus, papillomaviridae, more than 100 different types. Okay, at least 40 transmitted by sexual contacts, about 15 strongly associated with cancer. And by typing these, that's how they determined with the development of the Gardasil and whatever the names are from the other pharmaceutical houses, these immunizations that were roughly in that 11 to 25 age bracket. Okay. So most likely tiny, and again, this is typical of a wart, tiny abrasions in their epithelial. Trouble with these, that linings, well, it wasn't men, but yes, it is. You just saw the illustration. But it's almost the external genitalia in the male in many areas is particularly, it's almost similar to a moist lining that we would have in a typical internal lining. So it's all about, so it's even though it's supposed to be stratified squamous, it's tending more to it's supposed to be stratified squamous keratinized. It is not nearly as dramatic. It's more living cells on the outside than dying cells, and those are the ones that can be penetrated. Okay? So thought to infect tiny abrasions, and they talk about where the genome is located. Small percentage of infections result in cancers, and they do take a long time to develop, comparatively speaking. So the risk factors are there already. And sometimes you have asymptomatic individuals who are infectious. This is a big problem. These are difficult conversations to have with patients. These are difficult conversations to have with partners. Okay, big player. And you see this with a lot of these that now we're starting to get, because it's the long-term problems I'm interested in. Why was a little less emphasis on herpes simplex 2? Because we have Alzheimer's. We have more reliable ways to treat this and get a handle on it. Okay, and there's any number of different treatments that can be used. It is these what we used to call it. The fancy name was condyloma acuminata, and people used to use radiation, which actually with some of these could change them and really induce malignancy. I mean, I had a patient with that. I was very lucky, who they had used. It was a gal my first wife was going to nursing school with, and she'd had these treatments, and for some reason I just think I got lucky with my approach to it, which was more topical and things like that, and maybe I just got lucky. It was magically going to clear at the same time. Okay, and all the usual do's and don'ts. There's nothing curative. There's no way. So anyone who has this always has to be vigilant, and we hope they are. This is the annual. I mean, Pap smear guidelines have changed. Okay, and whether these are current, because this is 80 years ago, only you would know reproductive health-wise. This was the first of these vaccines, Gardasil, made by Merck, which is a big pharmaceutical company. Type 16 and 18 that cause about 70% of the cancers. Against it 6 and 11 that cause 90% of genital warts. Part of the routine vaccines. I do not know if this is true or not. That's the best I can tell. And when you're looking through these with the Papanicolaou, or however it's pronounced, now we just call it pap smear. You're looking for this kind of abnormal cells in the smear or the sample that's obtained during the examination. And they're there, and then there's a whole thing that goes on from there. It's you, a pathologist will look at these, and then there's a difference. And these are terms you're going to see on reports. You might see something it'll say dysplasia, Dysplasia. Dysplasia means it's changing. It doesn't suggest that it's cancerous at this point in time. That's one of the things they'll say, okay, rather than waiting a year, let's ask a few questions. What's going on? Let's go back in 3 months. Maybe there was some easier explanation, a urinary tract infection, yeast infection, etc. If it is meta means beyond. If it's metaplasia, now you're going to be interested. Most likely you're looking at some kind of additional treatment, maybe a biopsy, taking a section out and looking at a greater section. And then if it's anaplasia, that's bad business. Anaplasia is the last step. It means we're seeing, if you see cancer microscopically, it's so irregular looking. All the DNA and the chromosomes look all messed up. Now you got a major problem to deal with that patient. So the whole idea of the pap smear is basically, if it's starting to change, treating things early is always the best answer. Does it work is that 100% avoiding some terrible tragedy? No, but it's the best chance you have. So you can read through all of these things, multiple techniques, all the things that prevent it. I mean, there's just so much here. You could do a course on it. And here you could certainly do a course on this. So, I mean, I probably alluded to this before. I usually do this narrative because nobody here is teaching you guys, because they weren't old enough to do this when they were in clinical practice. Unless I'm missing somebody, and that's one of the nursing instructors or health science instructors who was there. This type of thing. And I think I've got them by age pretty good. Just a number. All right. So I started, and I was in my last year of medical school, last clinical year, 76 and 77. And we actually saw a case of Kaposi sarcoma, which we know now is an age-defining diagnosis in a male in our clinic, because it was common on the feet. You saw these bizarre things that looked like malignant melanoma. It was ugly looking. Big black moles that were angrier looking than that. And the guy who happened to be the clinical instructor, very smart. And he came back in and told us, well, never discuss it with the patient. I said, we'll be right back. Let's figure out a treatment plan. And he starts explaining this. And this has been around. We had no idea that this meant, I mean, retrospectively, if we had, again, almost to frame it, again, the two largest populations of gay men at that time, remember, it was basically closeted. At that time, it's certainly not open, were San Francisco and Philadelphia by percentage. No, nothing even close. Not much less of a percentage in New York City. They went to New York City to party. The guys from Philadelphia. Or they went to New Hope. Did you ever hear of New Hope outside? It's a place where it's got kind of neat, close to Washington's Crossing. It's one of those places in the evening where it was gay friendly back in the day when when people were very closeted. Provincetown, up off the tip of Cape Cod. It's like that. There was enough Fire Island in the New York Harbor. All of those were areas like this. And I wouldn't have known anything about it. Okay, but I'll continue the story as it moves on. And so he talked about it. We referred him, obviously, to a dermatologist, let them deal with the problem, because it was really sort of above our pay grade. We weren't going to remove it. It suggested something severe because it's a cancer. And we sent to a teaching medical school and let them deal with this interesting case. Less than a year later, I'm in my residency, and I'm seeing it there. Okay, and it's like another case. Yeah, so there's a small cluster for something that was described in the medical literature before the turn of the 1800s to the 1900s by Kaposi early on. And I'm seeing two cases where people rarely saw one in a lifetime. And then it became much more apparent what's going on. And I think I told you, okay, my first wife and I met when I was a resident. We moved in, probably sometime during summer. She said, okay, I ended up moving there because it was a shorter drive to work. Yes, in a part of suburban, if you're familiar with Philly and Northeast Philly. And he goes, I just wanted you to know about my downstairs neighbor. I sometimes had to be his date. Okay, that's an interesting statement to get. She goes, understand, John, he's gay, but I have to be his date for the Christmas party and for the awards dinner at his work because he couldn't bring one of his boyfriends, which there were many, to say the least. And I was totally unfamiliar with his culture. Totally unfamiliar. And I mean, I learned a lot about it because I mean, he's a wonderful guy. Uh, did well in his workplace, was a management position in his workplace, and everything like that. So I understood completely, and I found out that she had traveled in that circle because she didn't really know anybody when she moved there, and she ended up, you know, basically hanging out with them because they went to the clubs, they went to different places, parties, and things like that. I was flabbergasted. And I'm sitting there, and we would see the immediate apartment below ours, and like upstairs, downstairs apartment. And I'm sitting there, and I'm meeting some of his friends, and I could see this fellow, and they used girl names. That was very very popular. If you studied the late Freddie Mercury from Queen, that was very popular. They identify themselves with gals' names sometimes. It was just a trend. And he said, and when he was gone, I go, "What's wrong?" And I go, "We think he's got it." God, it was just a lot of our friends have this thing going on where they're getting really sick and some of them are dying. Hello, it's 1977. It wasn't first recognized in 1981. It was first written about with a cluster of cases that a physician saw, and he identified a rare kind of pneumonia, which we talked about earlier, in healthy homosexual men that seldom occurred in healthy people, and he studied it. And as he began to identify that they all had a common viral infection based on his bang, he described it as acquired immunodeficiency, and that became okay. Seeing this pneumonia became the first defining of someone with those positive indications of viruses, irregularities in their helper T cells, and voila, here it came. It was there. And you have to be around because of and thank goodness our society has moved along. The word that comes to mind would be antipathy. But to tell it to you, we were very intolerant of all kinds of relationships that weren't, the air quotes normal. Whatever kind of relationship, or people who had alternative lifestyles and stuff like that. You know, I don't know about you. I'm gonna be what you want to be, but be happy. I think that kind of solves it. But it's this is discouraged for being gay. Give me a break. And I began to look at it as time went on, and I found a interesting like Science Channel, and I think I told you about this as well, where and why the distrust for the vaccine, for making the polio vaccine and sharing it with maybe the least medically advanced area on earth that we had dealings with, sub-Saharan Africa, equatorial Africa, and basically doing it in such a way that whoever this laboratory that was hired by the World Health Organization managed to mutate this by using sick monkeys to grow the vaccine in conditions that only could be described as squalor. Dirt labs, sick monkeys, awful. And there's so much evidence to support that was the triggering point and why there's so much vaccine distrust. How it meandered its way here, I can't tell you. The reason why it was so common in gay men is it has to do, and you saw it a little bit before with warts. The lining cells, abrasions, physical, and the rectal mucosa do not have the reinforcement or the elastic nature that the vagina has. Period. End of sentence. So anal intercourse, which was the favorite kind of sexual contact between gay men, was a triggering factor and why it spread wildly in the gay community. And to give you some idea of the lifestyle, we went to the Oxford Valley Mall. I had a day off. My wife, I think we were married at the time. My fiance at the time. We say, oh, we're going to hang out there. We're walking around, we're going to get lunch. And all of a sudden he comes over and sees us because he's gone in a different direction. I'll see you at home. He picked up somebody. And by the time we got back home, did our shopping, come back home, he saw us home, he opened the door, oh, it's okay, he's gone. That kind of casual, I told you about casual sex. This was a typical casual encounter. Just a hookup, whatever vernacular you folks use. Gives you an idea of what was going on with those kinds of things. It's just boggles the mind. Okay. So maybe the teaching point, it is society can impact the spread of disease because of our lack of tolerance or aspects of whatever your feelings are about that. To me, this is all opinion. But I'm giving you the idea of how this started, and it didn't take long for this to spread all over and become very, very significant. Not just in all populations, affecting all people. And at that point, it had no treatment whatsoever. I'm sure I recounted that story with antivirals until some very, very famous people in the entertainment industry who were closeted gays or, relatively speaking, well-known to the industry as gay, but never thought to be in the public's eye. I mean, an action hero named Rock Hudson was one of the first people to die back in 1985. An action movie star. Played the tough guy roles, played the captain of the ship. Wonderful type of stuff. Romantic comedies. When he died, they began, and an entertainer was a crazy piano player named Liberace. When they died, that community band, basically, who are big money players when it comes to politics, said, we need you to fix this. And they created an accelerated program in 1988 called the Orphan Drug Act. And what that did had nothing to do with orphans. All it did was it brought medicines for diseases that really affected a limited number of people, which is still true, and made it easier for them and gave them a faster way to do it and basically financial rewards for doing it. Bang. And thankfully, we have a lot of treatment. Hopefully, they'll begin to do it for all of those things. These are the age-defining conditions. The ones we've talked about, you ought to be familiar with, like Kaposi sarcoma, okay, like tuberculosis, mycobacterial disease, including that, okay, certain kinds of pneumonia, that pneumocystic pneumonia would be one of those. I mean, there's a lot of these these are some of those. For instance, histo is one of those ones we were talking about with a deep fungal condition in the lung, with people who went caving. So assuming they don't have a history of doing that, it would be pretty obvious. Same thing, coccidiomycosis of tissues other than the lung, histo, because it should be confined to the lung. Those deep fungal infections, which are not uncommon in the lung, but all that type of stuff. Candidiasis, not in the mouth, but going in different. It's wild. So and this is ages ago. 35 million people have died 8 years to 10 years ago of AIDS. 37 million live with it. Okay, HIV, sub-Saharan Africa, most affected. I can only imagine the numbers now. The last time I looked, it was much greater than 1 out of 20 adults. Okay. So advances are significant but can't be cured. Indicates a person understand HIV positive is treatable. It is not, it's life altering. It is not shortening your lifespan. There's adequate medical evidence of this. There's good treatment that's only getting better with antivirals, along with good health and things like most famous individual, great athlete, Magic Johnson, all-time great basketball player. Count them, 5 championship rings with the Lakers in the 80s to the early 90s, came out 1991. ostensibly from multiple partners. No one's asking any questions. That's almost 40 years ago. He's physically fine. Okay. So it develops 6 days to 6 weeks after the initial infection, and most time there's no sores, there's no signs, there's no drainage, there's no nothing. It's like you had a bad flu, a cold, whatever, maybe even not at all. So the acute is mild. The viral replicate after the initial burst, levels decrease but persist in clinical latency. That is when, if someone is diagnosed then, if they do the test then, depending on the index of suspicion, there's a lot of factors, multiple partners, recent unprotected partners, etc. The whole drill with regard to that. And you start to treat them, you do what's called the viral set point. That kind of gives you an idea how contagious they are without treatment. And with treatment, it should only improve. And you can monitor it to see if the treatment is working. That's an important thing for somebody who has or you're talking to somebody who's having a relationship with somebody who's HIV positive. You never know what the heck you're going to run into in a clinical field. AIDS is the last stage, and all it means is the level of helper T cells, because it infects the single most important cell in your immune system. You surely learned about that CD4, which becomes the helper T cell, right? Everybody heard that one before? Hello? Good. That does everything. That's the one that activates your innate, activates your adaptive immune system. It sends out interleukins all over the place. It's vital. And what happens, it occupies those cells and it replicates in them. And as it spreads, it all begins to alter the rest of the population. And over time, without treatment, the level of those drops below a critical level that can be measured. It used to have to do with something called the helper suppressor T cell ratio, but they fixed it. That was in the early days when we started. Now we just look at the absolute value, or one of those different things that is an AIDS-defining illness. Somebody's HIV positive. And I mean, it's very much, again, like tuberculosis, weight loss, fever, fatigue, diarrhea, night sweats, not good. Extraordinary pain. I mean, you can look through this. I'm trying to give you, this is the acute phase, but this is the problem. Typical slow things like prion diseases, like mad cow, when they say slow, typical time, 2 to 10 years. So, I mean, I should have cooked that up to show you the pictures, and maybe I'll think about it for next time. Is if you look at the great Freddie Mercury, who was the lead singer for Queen and all those wonderful things, who's just vital force, very, very, I mean, very physical on the stage, very active, great front man for a rock band, crazy. Basically, he wrote Bohemian Rhapsody, it's all him. It has to do with his lifestyle, very interesting life. And if you see him there, and I commented this in the recording, you go back and find the thing. It's easy to find on YouTube. Him in 1986 at Wembley Stadium, a fabulous concert. And then you look at him about 3 or 4 years later when they recorded his last song. He's unrecognizable. I mean, anecdotally, the stories of people who were giving him care, the pain was extraordinarily intense. How did they make the diagnosis? He showed up with Kaposi sarcoma. Sores that weren't healing. Back as early as 1985. I mean, he lived it. To be kind, a hedonistic lifestyle would not be doing it justice. There's lots of biographies you can watch on YouTube that suggest it was a very interesting lifestyle. But we digress. Enveloped. Most of them are HIV-1. We see HIV-2 also in this country. Almost always see HIV-1. Well, you don't have to go into all these different proteins and matrix proteins. Just, it's a retrovirus, backwards. What it does is it replicates the RNA, it basically enters the cell, the enzyme changes the RNA to DNA. That process has none of our cells all have that wonderful DNA polymerase 3 to basically proofread it. Doesn't exist for RNA to DNA. There's so many mutations, it starts there. So it's a highly mutable virus. That's why we have to hit it. Where it enters, where it turns, where it goes from RNA to DNA, where it integrates with the whole cell DNA, how it exits and things like that. All of these agents attacking it, okay? And there's now four that are typically a cocktail of four of these agents, which you certainly don't have to know. See, you have all of these different proteins, and you basically construct antivirals that we now use commonly today: reverse transcriptase inhibitors, integrase inhibitors, protease inhibitors, and those look-alike or nucleoside analogs. That's typically the pill, and they've made them very, very affordable, particularly for folks in like sub-Saharan Africa or equatorial Africa, whatever you choose to call it. Very complicated virus, a lot of embedded enzymes that are part of it. So thankfully, this is the crazy thing, does not survive well outside of the body. Just like something like syphilis, it's a bacteria. A lot of these sexually transmitted diseases, warts are the exception. I should have mentioned that. Warts on surface, that dirty toilet seat thing, warts. That's the one thing where you got to watch out for objects. Okay. I don't want to get graphic, but objects might be used somewhere in, depending on what, as my daughter would say, what floats your boat. Everybody get the idea without me getting graphic? Good. I'm trying to do this professionally. It's maybe the only lecture I do professionally. Okay, semi-professional. Were you as astounded as I was that the Rams took that quarterback? Are you kidding me? No draft followers. What? So all of these types of things that are there, CD4 cells, found on helper T cells, macrophages, dendritic cells, blah, 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 blah. It's a complicated process you don't have to go into. All the type of things here, it's more read-through material. Slight differences in new variants due to mutations allow HIV to evolve quickly, altering antigens and avoiding the immune response. It's like it's pre-programmed to be extraordinarily difficult to treat. So it's all about recognition and dealing with it early. Helper T cells killed by the HIV infection, adaptive immunity weakens. They serve, and what happens is the macrophages and dendritic cells, hello, that's where they're growing and all that. They don't function normally, no immune response. This is the critical number there. T cell counts below 200 cells, which we can measure with modern techniques, per microliter. And then, oh boy, half of untreated patients progress to AIDS within 9 to 10 years. Others with low viral set points survive many years. If you were to ask me about whatever happened to this fellow who I knew almost 50 years ago, we lose contact. As you do when you move on in different places that were there. I mean, given the time and the amount of exposures he could, knowing the people in his orbit, he may have made very well. There's some very, because you couldn't be open about your sexuality, or in this case, their sexuality. It was bizarrely done in some very strange places. They even did a movie about it, which was very graphic for the day, that Al Pacino was in, one of his earlier movies, called Cruising. And they actually filmed it in a location that was made to look by a wild bar club that was gay only, called the Mine Shaft. I mean, they used to go there, so I can only imagine what went on it. Okay. I grew up in a very sheltered environment. I'm sorry. So all of these things present in all kinds of secretions, sexual contact, doesn't matter, blood and body fluids, up until, I hope you had this, I probably stated it to you, prior to 1987, there was a tremendous risk of getting either hepatitis C or HIV from transfusion. Roughly 1987, blood bank blood became kind of the second safest blood you could get. The safest blood you get to do an auto transfusion. You have to have a hip replacement, doing a couple of, a month or so. They plan these things, they're elective, put it on board, shoulder operation, big cosmetic surgery. Directed donations are less safe statistically than blood bank. Directed donation. Oh, Uncle Charlie's got the same blood type. He'll give his blood. Well, you don't know where Uncle Charlie might be, not being as careful as Uncle Charlie should. Statistically, not a knock against you having Uncle Charlie. Who knows? But since that time, that's where I am convinced my first wife got hepatitis C, because she had transfusions in 1981 after what they call wedging ovaries, an ovarian procedure to try to make her more likely to get pregnant. They were not successful, but she had 2 units because she turned out to have a hidden bleeding disorder. Give you an idea. So, I mean, I sincerely think that's where it came from. So I got a lot of information for you guys. So shared needles, needle exchange programs have been valuable. People think that you're just encouraging it. You can, from a health and safety perspective, they work. It's the same thing. I mean, there's so many things that have tipped people on either side. Having Narcan available so people don't die from overdoses. Health and safety, it's a plus. Tacitly sending your approval about a lifestyle, different entirely. Okay, healthcare workers, very low risk for HIV positive, 1 in 500 for a stick. AIDS, totally different ballgame. Now it's in all of their secretions all the time. HIV positive, it depends on their set point. Typically, they'll know their set point, and they'll know, and you'll be able to have an idea from the records if there's any risk whatsoever. You don't have a choice. You go to work in a hospital, they're telling me, you got to see this patient. There's some overwhelming reason. Now they're screened for all of these, okay? Presence of HIV antibodies means blood is not used. And again, a lot of problems with this. This is another thing. It's a great thing we talked about being carried on in pregnancy. There's tremendous statistical advantage of the mother being treated during pregnancy to reduce the likelihood of the baby being born with HIV and developing AIDS. Tremendous. Prenatal treatment, extraordinarily important. That's part of the recognition that's there. Not highly contagious, mostly behavioral, not spread by really casual contact. Shared needles, promiscuity, whatever you want to describe it as. All of these different histories, other types of any lesions that are there. Had blood or sexual exposure to any of the people listed above that. Okay, the antiretrovirals are available. There's a lot to know about this stuff, but you can see kind of what happens if you look at the charts. Age-related deaths of all ages, HIV treatment coverage. So as the coverage went up, deaths went down. Good thing. And this is just a list. You don't have to know any of that stuff. The antiretroviral therapy, they call this HAART. That's something you might have to know down the road, like for an NCLEX exam. Be familiar with this. Quality of life, reduces risk, lowers the set point, blah, 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 blah. Readable. Lowered risk significantly. That's the point I'm trying to make. Also reduced in vitro fertilization, organ transplants, the exchange programs, really being aware of what to use, even though they don't survive particularly. Any good disinfectant should help. Therapy for the mom, infant by C-section, et cetera, et cetera. So we understand the process has been very, I do not know. And they've tried with this therapy to try to make the virus go away. There have been some limited cases where they indicate it has been successful. There's certainly no convincing evidence long term. Next one, Trichomonas vaginalis. Remember my list: HPV, herpes down here in the middle, Trichomonas vaginalis. This is very frequently asymptomatic, but it can be, if anything, this might be the ones that's also symptomatic, and the discharge is not pleasant. And the pain and burning with urination, redness, inflamed. This is a protozoan, and protozoans we characterize by how they move. These are flagellates. They move, they twitch. And that's how, when you can look at a sample of drainage under the microscope, you can almost, if you see the twitching, it's almost like slam dunk. Eminently treatable with metronidazole. It is an anaerobic. Talked about this before. It's an anaerobic entity, just like anaerobic bacteria like C. diff, okay, like that Gardnerella I was telling you about. Okay, this is all part of it. Men have a discharge, burning pain, etc., etc. It works for both, obviously. This is what it looks like. This is making its way around in the genital urinary tract. I don't know about you, don't want one. We didn't even know what this was. They would treat these sort of generically back in 50 plus years ago, okay, with basically give people ampicillin because they were assuming they were orally, they figured they were treating gonorrhea and hoped it worked. They really didn't know the pharmacology terribly well. And so all of this, it's nasty, the jerky motility under the microscopy. They don't survive well, thankfully. Don't have mitochondria, that's the anaerobic. Not fully understood. Adherence factors, colonize. Frothy discharge probably has to do with anaerobes, generally are a little bit are gassy producers. No reservoirs other than easily killed. All sexual contact almost exclusively. A lot of these moisture helps these things survive. So people have to be careful. It's like you certainly wouldn't use somebody else's washcloth or towel. You and I wouldn't. But you have to understand not everybody has the same lifestyle. We'll just use what's convenient depending on things. Again, that's part of the trend. Rate highest in men and women with multiple sex partners. Again, all of these increased risk. And they go through it again. Metronidazole, probably a different version in the same category, is a big, big success rate for this. I mean, this is, now see how long ago this was. End of 2015. About 37 million people were living with HIV/AIDS more than 10 years ago. Look at the numbers. Now, real quick jump over to here, because it's more for the numbers than anything. And this is just sort of recycling. They don't have any, thankfully, they don't have any more yucky pictures. Recurrences, average recurrences, genital herpes 4 to 5 times a year. Encephalitis, potentially even when somebody is being treated. Remember how herpetic infections move, nerve pathways that were there. This is the one, the neonate and the fetus. In most cases, the infants are contaminated immediately before or during birth, and transmission from the mother's lesions to the baby. Okay, pregnant with a history of recurrent infections, especially in the last 4 weeks. Any evidence of outbreak at the time of delivery necessitates a C-section. They used to have a horrible picture, typical herpetic lesion that you can see there. Gone through a lot of this stuff. Oh, here we go. More modern numbers. 4 billion out of about 7.7 people are infected. Not with, this is with the typical HSV1, human herpes virus number 1, the cold sore most of us have. Okay, environmentally, just to get, I'm looking at the numbers. Herpes is more common than chlamydia and gonorrhea, but is not a reportable disease. Because that, more than half the people in the world have it. You're not going to make it go away. No vaccine. Here's HPV, went over it. These were, imagine these like tiny heads of cauliflower. Each year in the United States. And just, I think it's hard to convince somebody who's reluctant to get examined for whatever reason, that particularly during, your sexually most active years, to be checked consistently. The male penis, anus, much less common than cervical cancer, but they can be affected. This is talking about the oral consequences that are there, etc., etc. They'll give you the numbers. I'm not asking about the numbers. Activating, remember we talked about oncogenes? They activate them. It's kind of like the brakes. You lose your brakes. get HPV, and this is why it's limited. Was this? It's interesting. I mean, I'm not making a value judgment. College is a time where people explore a lot of options, and I'm not. I'm sure statute of limitations expired. I was no different. I'm trying to add a little levity to this, but probably the wrong time. This is the limitation of that immunization, even though it went from being like 11 or 12 down to like 9. Okay, it's very, very safe, to my knowledge, my limited ability to research this. But the end point by 25 or 26, it's just entirely too likely that you've encountered. Okay, same type of thing. This is molluscum contagiosum. I talked about that with pox viruses quite a little while ago. Again, it's typically frictional, and we usually see it in the upper thighs. That you can remove really easily by numbing it and using an electric needle effectively to cauterize it. Thankfully, it is not, the nature of the virus is not one that stays with you and recurs unless you have another encounter with it. This is that group B streptococcus. This is one that's a new player. This beta stem in the Lancefield group B. Okay, this is one of those with, unfortunately, and this is what they check for. Okay, as part of the gynecological obstetrics and gynecological workup, have the infants become colonized. This is when they were talking about Semmelweis. He was all worried about strep infections. This is what was becoming from that streptococcus. And they're just showing you the locations, and I think this covers it. We'll start wound infections. I appreciate your attention. It's not an easy, again, it's a hard week, I think, for anybody to teach myself.